Hi, I'm Murat, and I'm going to be doing a video series called TechTalk, which will be discussing ideas and topics that have to do with RVTs or anyone in the animal hospital setting. So, for those of you who might not know, an RVT is a registered veterinary technician who is basically an animal nurse. So, the first topic I decided would be empathy. Something I feel is often overlooked, not really talked about much. People always talk about the physical aspects of the job, but not so much the mental game that goes into it. So I thought this would be a really good place to start. So what is empathy? Empathy is the ability to understand and share the feelings of others. Basically, putting yourself in another person's shoes, which obviously it's not possible, but trying is what really matters when it comes to empathy. Why did I choose this topic? I chose empathy because I've worked at an animal hospital setting and a few other jobs for quite a few years now, and it's one thing that I strongly feel is lacking in the majority of the employees. Maybe it's just me, but it seems like most people are trying to just get done with the day, to just finish up and leave, and they don't put much thought into what they're doing or how they're doing it. They just try to finish up, just get done with the task and move on and go home, because it's just about the money. So how do you put yourself in someone else's shoes? It's probably not the easiest thing to do. I'm gonna speak about empathy towards animals and empathy towards people, because in the animal hospital setting, both are the case. You need to be able to understand both the dogs, the cats, and the humans. A lot of people put a higher importance on the animals and less of an importance on the clients. They don't want to deal with the clients. The clients are annoying or stupid, but these are the people that are taking care of these animals, and if you want them to do a better job, then it would be wise to care about them as well, to help them understand instead of just calling them stupid. So I feel it's really important on first note to have good client care and good client education. Secondly, when it comes to empathy towards animals, I feel like there's a large number of technicians and technician assistants that just try to get the job done, and they don't really try to feel the pet out. And what I mean by feeling the pet out is, why is the animal scared? Why is it aggressive? Could I be doing something better? Could I create a less stressful environment for this animal? These are all things that are really important for the future of the practice and for the future of that animal's well-being, but they're often overlooked. So the best advice I was given by one of my teachers during the RVT program at Pierce College was to be patient-oriented and not task-oriented. So let me break this down. It's basically what I just talked about. Trying to understand the patient's needs. Every patient is an individual. And you're probably thinking, duh, of course they're an individual. But they're usually not treated that way. They're usually treated like a task, not even an animal. Like, okay, we gotta do chop, 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 and then make a salad. So things go wrong when you don't cater to the patient's needs. If an animal is aggressive, there's a reason. If an animal is freaking out, there's a reason. Maybe it's a chow. I'm not against, stereotypes. They're there for a reason. But there's always a better way to do something rather than just accept the worst case scenario. So let me give you a few examples. Nail trims. When doing nail trims, every animal responds differently. So if one animal might do better if you just hold it in your arms and hold its paw out and restrain the neck against you. Smaller animals do pretty decently with that. Some animals, larger animals, do better on the floor. Sometimes it's difficult. You want to lift the animal and put them onto the table, but there are a few that completely freak out the moment you try to pick them up. So things you can do to help the situation. One is when you go to pick an animal up, let them know you're picking them up. I often see people just boom, grab the animal right onto the table. That's scary, okay? This animal doesn't know if you're gonna butcher him or if you're going to, eat him. He doesn't know. He doesn't know that you're there to help him. You're sticking a thermometer up his butt and Q-tips in his ears and chopping his fingernails off. To him, you might as well be chopping his fingers off. He doesn't know. So you need to communicate without speaking that you're there for this animal. And you do that by gentle touch and touching before you lift them. So, just like a horse, you wouldn't approach a horse and just grab them, You come from a certain side, you put your hand on their shoulder, let them know you're there. Because if you mess up with the horse, he's going to turn around and knock you out. Some of these animals can't do that. But you're still trying to prevent stress and making your life easier. So, pet the animal. Say, hey, it's okay. Say something. Run your hand down their back, pet them, let them know you're a friend and you're not just going to grab them and throw them up onto the table. And then try. Oftentimes, it works. Many times there's an animal that's a go slow or an aggressive pet, and I put a muzzle on them and I gently go to pick them up after petting them, and they do superbly, and the doctors are really surprised. Wow, he's never been so nice. I'm surprised. And I tell them, well, it's because I know how to treat them right. But sometimes even that's not enough. So don't pick the animal up, You don't have to. Unless there's, if you don't have to, at least. I mean, if it's a nail trim, in this scenario, you don't have to. You can do it on the ground. If this animal, let's say it's a chow, is gonna flail and fling poo everywhere and anal glands, which I've seen multiple times. The moment you go for that pickup and you see him start to huff and puff and, he starts to poop, don't continue. Don't lift him onto that table and create the biggest mess of the day. Just stop. Let him chill. Let him relax. Do it on the floor with a lighter restraint. Sometimes I find some animals really freak out when you're under their belly. Do an overhand. And if under their neck is freaking them out too, this might be controversial, but if they're not freaking out with your hand over their head and you can push it kind of against your thigh and just kind of hold them like that, then do that. Be creative. Find a way to do it so that the animal doesn't freak out, because it makes your job easier. It stresses them out. It reduces their stress, and overall it produces much better results. Lastly, I want to speak about when you have no other choice. So you bring the animal in. Since we've been talking about nail trims, I'm going to continue on the nail trim. And it's not having it. It's completely freaking out. You can stop. You don't have to continue. If you're causing more harm than good, a nail trim is not worth it. You have to weigh the importance of the task at hand alongside the pet's well-being. And nail trim is down here, and the pet's well-being is up here. So, obviously, if the pet's freaking out and squirting anal glands, don't do the nail trim. Ask the doctor if the client would be okay with sedation, and if the doctor would be okay with sedation. You have the right to ask. Don't be shy about it, basically, is what I'm saying. And if they give you the go-ahead, wonderful. Better for the animal, better for you. They get their nail trim, client's happy, patient's happy. If they say no, you gave it your best shot. Maybe in another scenario, maybe you reschedule. Let the doctor figure that out. But your job is to make sure the pet is safe. So, nail trim comes second to that. So finally, I just want to say thank you for listening to my first video on TechTalk about empathy. I really appreciate everyone who listened. I will be doing more videos shortly, and I hope you like the information. I hope you comment and let me know what you think. Give me some ideas. What would you like to hear about? Just, let's start a discussion. I'd really like to hear everyone's input. Other RVTs, I'd love to hear what you have to say. I'd like to start something and hopefully create a little community of RVTs that just want to make the practice a better place for everyone. Thank you.